new and emerging approach in psychiatry is thinking of our patients from a strengths-based perspective. And at this year's ECNP in Amsterdam, I saw a poster that really got my attention that I would like to share with you, which is not looking at someone with a psychiatric disorder like ADHD as only suffering from a set of psychiatric pathologies, but perhaps also from specific strengths that the individual believes are directly derived from having that condition. So DSM thinks of disorders as only difficulties. Every symptom is a challenge. It's something to be squashed. There's no thinking of strengths, the advantages of having that condition as perceived by the patient. So check out this poster. When individuals with ADHD were asked, what are some of your difficulties and what are some of the things you like about your disorder, look what they said. That having ADHD in their mind made them more creative. Also, it increased their sense of humor, allowed them to have greater hyperfocus. So maybe psychiatry has been wrong in looking at psychiatric disorders only as a basket of symptoms that need to be squashed out. And to perhaps start thinking, while that is true, there are symptoms that really impair a person's life, but there are also many strengths that are derived directly from having that condition as perceived by the patient. And I think that is extraordinarily important for us to appreciate that, for us to acknowledge it, and for us to nurture it in our patients. I think psychiatry is on the cusp of moving into the era of psychiatry 3.0, which is no longer seeing our patients as nothing but people with symptoms of pathology, but perhaps people who deserve for us to look at their weaknesses and the strengths equally. This poster was very impactful on me, and I hope as you yourself examine the details on this poster, you see that there is a different way to look at our patients with various psychiatric disorders and to acknowledge to them that we see the benefits you perceive in your condition along with the difficulties, and we wish to acknowledge it and to nurture it, and we will do our very best to offer you treatments that while they reduce your symptoms, they do not take away the positives you perceive regarding your condition. Anyways, I hope you found this poster to be as fascinating as I did, and maybe you are at a place in your professional development that you too are ready to start embracing the concepts of what I'm calling modern day psychiatry 3.0. Bye for now.